The Consortium of Health and Military Performance, also known as CHAMP, of the Uniformed Services University of Health and Science, known as USUHS, is conducting a study to understand a possible genetic link between sickle cell trait, known as SCT, and exercise-related events, known as EREs, such as exertional rhabdomyolysis, muscle damage, heat stroke, and or collapse. We are inviting African-American men and women with sickle cell trait and their family members to participate. Participating in the study will require you to complete a health history questionnaire, a form authorizing our study physician to gather health information from you and your healthcare provider, as well as a one-time blood donation. In order to qualify for the study, you must meet the following criteria: be African-American, be sickle cell trait positive, be able to read, speak, and understand English, be between the ages of 18 and 80, and currently not being treated for any mental or psychological disorders. Participation is completely voluntary, and your decision will not impact your healthcare. The results for this study are for research purposes only and are not intended to directly benefit any individual for confidentiality reasons. However, the results of this study are intended to help better shape policies and associated health risks affecting the SCT community. Participants may be compensated for their time. To join the study, or if you would like additional information regarding the study, please contact the study team by phone, area code 240-479-9514, or email sctstudy-ggg@usuhs.edu.
The views, comments, and opinions of the following program do not necessarily reflect those of Morris Media Studios, MorrisMediaLive.com, or its affiliates. Listener discretion is advised.
Hello. Welcome back. I'm excited about today. It's Wednesday, Conversation with Faye Lewis. And today, Skip, John, and Marcy isn't here, but we have a special guest, Mrs. Zola. Is that how you pronounce your last name? Because you got married.
Taylor Jackson. Mrs.
Zola. This is my sister. And so today I brought her in because she's been doing private duty nursing, caregiving for a very long time. And I have too, over 20 years. So today we've know a lot of people that's doing caregiving, and sometimes it can get very stressful, overwhelming, taking care of a loved one, maybe your parent or your mother or your father or both of them. So today we welcome you to call someone and tell them to tune in. And if you have anything you want to say, you can always call us. So today is Wednesday. This month is going by so fast. I heard that, are we supposed to set the clocks up or back, fall back this weekend? Did you hear that?
Fall back, spring forward.
Spring in the forward, in the autumn, in the fall, they fall back.
Yes.
So I thought I heard it was this weekend.
Don't ask me.
Don't ask you. Well, I'm so glad to have you here today. How you feeling, Zola?
I'm feeling fantastic. I'm feeling excellent. Every day that we have an opportunity to open up our eyes and place our feet on solid ground, I know that is something to rejoice about. And because of the field that I'm in, I cherish that even more.
Yes. Okay, before we get started, we're gonna take a second of word of prayer because we want this show to be stimulating, encouraging, and uplifting. So we're gonna ask Zola, lead us in a quick prayer real quick before we get started.
Heavenly Father, we just thank you for today, Father God. We thank you, God, for your skillful and your watchful hand, how you watched over us and kept us, God. And Father God, let your light shine through us, God, and we don't take it lightly that you've given us this opportunity, God, to share a word with your people, God. Now move through us, God. Illuminate the atmosphere with your presence, and we say thank you. Amen.
Thank you for that, Zola. So we had any latest news? Yesterday was 9/11. So it's been like 17 years. That's unbelievable. But that was a very touching moment 17 years ago when that happened. I can remember when 9/11 started, that day it happened. I was getting ready for work. I was working for an attorney in Pasadena, and she was calling me like, "Come on, you're gonna pick me up. We got to get going." I was like, "Nothing's moving. Everybody is standing still," So that was a very emotional and a day we will never forget because the United States didn't know what was going on, but that's why we got to stay covered in the blood, covered in the blood, because we don't know. I was looking at a movie called Surge the other day, and that's kind of scary to me. I don't like scary movies. It's happened like 12 days just evil, or 12 hours just anything goes. It was crazy, but we don't know. We know that I heard a minister say this last week, that we don't know the day or hour that he comes, so we got to be ready. Amen. Because when the bridegroom came and they closed the door, you couldn't get in. Amen. You know, so he said when God comes back, he's going to raise up the ones from the dead first. Yes. And then we got to be ready when all this happens. And we don't want to have went to church, been a good person, didn't curse, changed our life, and still missed the mark. You know, that's like saying getting all the way to the door and you done lived 20 years, you know, sitting in church every Sunday. And so we have a phone call. Let's see who's calling us today. Hello, caller.
Hello. How are you?
I'm fine. Who are we speaking to?
You're speaking with Regina Singleton.
Good afternoon, Regina Singleton. I know you. I'm so excited that you called in because this, you know, my sister Zola, she's a caregiver and she's been doing it for years. I've been doing it, and I know that you take care of your mom and dad, and I had the honor of helping her with her mom and dad. Very wonderful, beautiful couple. I mean, her dad and her mom, I mean, it's a pleasure to work for them. So what's make you call us today, Regina?
Well, I want to talk about caregiving, and especially the caregivers. It's such a hard job for us caregivers taking care of people, whether it's your loved ones or best friend or spouse, whatever. It's very hard to take care of them. And also, we need the help of the hospital.
Yes.
And why I say that is because, and I'm going to start off by saying it like this, all matter. And why I say that is because you can take your loved one to the hospital, they'll patch them up and send them back home. And it's up to the caregiver to get them well. Mm-hmm. Well, our job is to assist, make them comfortable, laugh, companionship. Okay? Mm-hmm. Not to get them well. Mm-hmm. So it starts with the health care. Now, if the health care does what they're supposed to do, it makes it a little tad bit easier for us caregivers. Because as caregivers, when we do take our loved ones to the hospital, the doctors ask us questions. Mm-hmm. Okay. So that means that we have time with them than the doctors. Mm-hmm. Okay, so why don't the doctors listen to us and what we're saying? Don't listen to us that are on the side of your... Listen to us with your heart.
So what I'm getting that you're saying is that when we're taking care of someone and they become, we know they're elderly and they have different medical conditions, health conditions, and we take them to the hospital and they'll ask us like, what's wrong? And we tell them what's going on, and then they'll give them a prescription and send them home. When they're really, and we know that's the way society is. After our senior citizens get a certain age, and I've dealt with many senior citizens, I've taken care of so many elderly people, to when they get to a certain age, society kind of like brush them to the side. Mm-hmm. You know, they're not really trying to get them well. They're taking the insurance money, but they're just saying like they're old, they're going to die, which people can live to be 100, 109. How old? You know, we don't know that. That's God. You know, exactly. So we, you know, even though they sent them home on hospice, I've seen people went on hospice. I've seen a couple people go on hospice and come off. So, you know, where they was like, they've done all they can. So it's really, I do understand. And have you taken your mom and your dad recently, and you had some kind of situation?
Yes. As a matter of fact, Friday, my father wears a catheter. Uh-huh. Okay, and in June, there was a nurse that came to the house to change his catheter, and my father does have a enlarged prostate. Uh-huh. So as she was putting the catheter in, there was some resistance there because of my father having an enlarged prostate.
Right.
So when she pulled the catheter out, there was bleeding and blood clots. So I had to rush my dad to the hospital. Okay. And my mom, the same day. Okay, because her mouth was twisted and they thought maybe she was having a stroke. So what happened was, we called ambulance. They came to pick up my parents, and they kept my mom. Now my father is bleeding. They put another catheter in him and sent him home. The next morning at 7:15, when I go in to ask my dad what do he want for breakfast, I pull the cover back to check him, and he's laying in a pool of blood. So I had to rush him now back to the hospital. He spent a whole week before they did anything, and I stayed with him, and he was bleeding. That's how come I opened up my statement saying all lives matter.
Yes, it does. It does.
Lives matter.
Yes.
My mom's life matter.
Yes.
And so even with the doctors and the nurses, okay, come on. Let this be your passion.
Yes.
Anything that is your passion, you put your best foot forward. Even if it's not the money. This is something that you love doing. It's your passion. Compared to it being a job, all lives matter.
Yes.
If it's just your job, you ain't going to want to go. Then you're going to get snappy. You know, you're not going to put your best foot forward. And we're talking about you dealing with people's lives, just caregivers too. There are some that are going your house and steal this, that, and the other. If it's not your passion, don't do it.
That's right. That's
Let it be your passion so that elderly person can feel love. Or that person that, you know, don't have any relatives or kids, and it's just them. Yes. And when they see your face, they'll light up like a Christmas tree.
Yes.
You want them to be, you want your patient or your client to be happy to see you, not frown.
Right.
And say, don't open the door.
Right.
You understand? You want your parents, loved one, child, whoever, to go to the hospital knowing that, okay, you know what? I'm about to be taken care of because daddy worked his behind off or mommy worked her behind off and got us this insurance, okay? And they're relying on Kaiser or White Memorial Hospital, whoever.
Right.
Dr. Sam, Dr. Doolittle, whoever. That's going to help. But let me say this to the audience. The people that I just mentioned, the doctors, the nurses, the caregivers, we're mere people. We're human beings, and we make mistakes. But first of all, go to the Lord. Go to the Lord first. That's what you do.
Yes.
You go to the Lord first because as we can see, we cannot put trust in man.
You know what? You're so right when you say that, Regina. We have another caller, so in a few minutes. But also I wanted to come in on what you were saying about your parents. And we know that because I talked to you a while back, and he had the same problem like 2 or 3 months ago. So they're not trying to cure this problem. You know, they're just patching it up. You know, so we, like you say, we have to really get on our, I guess that's going into our medical, our politicians when it's talking about medical. We're going to have to really change that. And every year they change up. Like I have Blue Cross Blue Shield. I just got a booklet, what they're going to be doing in 2019. And it's like amazing of, okay, now what you got to pay this, you don't have to pay that. And so they start coming up. It's all about the money, you know. So, but thank God that your parents, and I know that it can be very overwhelming with one person taking care of mother and father. And I know you're a daddy's girl, and I know you love your parents. She can't even talk about her parents. She'll break down crying. She loves her parents, and that's a blessing that they have you. And we're going to be continually keeping you up in prayer, and you stay on and listen to us because we have another caller come in, and I got a couple of things we want to talk about, but I'm happy that you called in, Regina. Is your dad home?
Yes, he's home.
And your mom?
Yes, they're both home.
So the bleeding has kind of calmed down a little.
You know what? The bleeding stopped yesterday, and I took him to the hospital. To see his urologist on Friday, and they went inside, his penis, looking with the little scope, to see where the bleeding was coming from, and we really couldn't see anything.
Right.
Okay, and I looked myself. Okay, because I wanted to make sure. Like
Absolutely.
I said, all
Yes.
lives matters, and especially my daddy and mama.
Right.
Okay, so now he said, well, I can't see anything. I'm like, well, what is that? This is a red area, and it had a line like a blood clot. He said, oh, that's probably where they scraped to see father had cancer. Now, it's just not him bleeding. If you saw something, you had to scrape to see if it's cancerous.
Right.
You're gonna like, after the procedure, after the surgery, you're gonna send my dad home? No, let him stay in there.
Right.
Just like Friday, okay, you could not find where the bleeding is coming from, but you want to send him home?
Right.
How
Yeah.
come you couldn't do any observation?
Right. Right. Well, we're going to be keeping in prayer, and we're going to talk about that a little bit more. So you stay tuned, okay?
Yes, ma'am.
Okay. All right.
God
Good. Thank
bless you.
Bless you. One thing that she was talking in depths, but if you've been a caregiver for years and you've taken care of elderly people or even young people, they have young people that's sick. It sounds gross what she's saying, but this is what upsets us, because there's people in the home that needs help, and you're trying to take them to the hospital, get them to their doctor appointments, and you're trying to figure out, okay, why can't we cure this? Why do, this man have to be bleeding for months and months because he's 80-some years old, So I just know that we're going to keep Regina and her family up in prayer. And like I said, I had a chance to meet her mom and dad. I think they've been together like 50-some years. And I love their love story. I love their love story. I remember her dad told me he looked at the 10th grade and her mom was in 11th grade. And her dad looked across the schoolyard and said, that's going to be my wife. So that's a good, so Amen. That was, yes. But so Zola, tell us about, how long you've been doing caregiving or private duty nursing.
Well, first of all, I started with healthcare when I was in high school. I took it as an elective to get some added credits. And I started as a candy striper, and from there, I did a year at LACC to go into the RN program, but through the interims of life, I geared to the left, geared to the right. So I then continued. I got a CNA, and from there I went on and I got my LVN license. But in the interim of working in the hospitals and dealing with convalescent homes and all the politics, and I am very passionate in what I do, and my attitude sometimes gets in the way because I love what I do, and I'm an advocate for the patient and the family at all levels. I decided to step away from the acute aspect, working in the hospitals and so forth, and I chose to do home health, private duty, and it has been very lucrative for me, and I know that that's God, and I love it. There's different levels and aspects of that as well. And one thing that I wanted to share with Regina and with your listeners is that whenever you're concerning and dealing with health, you have to be proactive. You have to get involved. You have to ask questions. And no question is a crazy question, a non-valid question. You have to get involved and question from the top levels all the way down to the bottom. And it is a collaborative team when you're dealing with home health care and your loved one. You have to get involved.
And one thing I know that nowadays, well, a few years ago they started that when IHSS started bringing in private caregivers and 1 and 2, then they all wanted you to take this class. Then they wanted you to be active with the doctors.
Absolutely.
So that makes, so now even with Regina, maybe we're going to have to get a team, have them to get a team together, because they do have the nurses coming to the home. They do go, back. Somebody needs to get together and figure out what are we going to do about this bleeding.
Well, the thing is, first of all, that's when I was referring to be proactive. You have to get involved. There is what we call a nurse team, a care team, and a care plan. You have some doctors that get more involved and more caring about their patients, and you have some that are just overwhelmed. But it is, I'm going to stress, it's up to the family members. It's up to your care team, individuals that you have coming in and out of your home who is assisting you, that you have to get involved. And the more that you are involved as a family member, for whatever reason, it tends to have the other people that are in that circle, they take more time, they're more considerate, they may extend themselves more. So we have to get our own selves educated.
Yeah, well, I know that for a fact. Regina's very active, and proactive, like you say, with the nurses, the doctors, the physical therapists. One thing I know, she's right on it.
Wonderful.
But like she's very much on it, you know, when it comes to her dad, very. And so she's put her life on hold to take care of both of her parents, you know. And so I know I had, like I say, the honor of meeting them, and it is a lot of work, you know.
Absolutely.
And, if I've taken care, I had one patient for 11 years, Miss Esther. Matter of fact, yesterday was her birthday. If she was living, she would have been 93 years old. Yes. But that was an honor for me to take care of this woman. When I met her, she was walking up healthy, fine. I met her like at 78, and she passed at 90. And I was her caregiver from 78 years old to 90. And I take that as an honor because I got a chance to show her love. Sometimes it was so overwhelming, I had to bring in other caregivers to help me, but it's a very overwhelming job, and especially when it comes to your parents. And then I have another friend that's taking care of her daughter, which has autism, so she can't go to school. She was going, but now whatever she's going through, she can't go to school right now. So she has to take a family leave from her job to whatever help. They're trying to figure out what's unbalanced going on with this child, and that's overwhelming for her.
Very. And it's so important as being a caregiver, and when you are dealing with your loved ones personal on hand, you have to have some type of support team.
Yes. Whether
you are involving siblings or nieces or nephews, grandchildren, it's very hard. What makes it hard is if it's on one individual.
Yeah.
So you have to collaborate, again, with your team. And then with the team, you have to incorporate a good support team so you don't get burnout.
Yeah,
when you get burnout, that opens the arena for other things because we're all human.
Yeah.
You get frustrated easy. Your patience may be short. Although this is your loved one, that comes along with the territory. So it's very important.
And in any professional psychiatrist or any professional person would tell you that deals in the health field would tell you, you have to take a break. You have to take a break. Yeah. And sometimes some people say, I don't have no one to help me. So we're looking for, we're going to have resources. Next week, I have a lady coming to talk about real estate, but I'm also going to bring in some information about the different agencies that are here to help you, different healthcare plans, because I know you can make a certain amount for one program, and then one program you can have a certain amount of hours, then you can get more hours. So we want to do this to help. So we're going to have resources each day that we have a certain subject that we talk about and not just talk about it.
Amen.
And then one thing I know, I think that caregiving, when you're dealing with a person that has diabetes, high blood pressure, they have so much going. They've had surgery. They've had bypass surgery. Then they're dealing with cancer. So every day you have to be very attentive to that person.
Absolutely.
And Miss Esther went blind. So that means that she totally depended on me. And I had to make sure she was clean. When you come in my house, you wouldn't even know it was a senior citizen, 2 or 3 there, because the way I kept the house. So if you have someone that's doing caregiving, have them to call in to Conversation with Faye Lewis and Second Call. And the number you could call live is 323-293-3375. Again, 323-293-3375. Call and let someone know that we're on the air. So, Ms. Zola, when you take it, I know that you was doing private duty nursing, taking care of one person, then they have the other husband or wife that's well, and you go into their home to take care of them. Sometimes even for the parent, the husband or wife or child that's there, they have to feel secure. You know, you have to, like, your caregiver to me have to match up. You know,
absolutely.
If you don't, you know, what I'm trying to say, they have to, like.
Well, I know what you're going to say because we are sisters and kindling spirit. But a lot of times when I go on an interview, they think they're interviewing me, but in essence, I'm interviewing them.
That's
I'm
right.
checking out the atmosphere because in doing caregiving, you have to make sure that it's a match.
That's what I'm trying to say.
It is a match because a lot of times when you go into a situation, you could have children or the other spouse where they will absolutely hinder the care that you would be giving to the individual patient, to the client. For example, and you have to always, when I go into a situation, I'm led by the Holy Spirit. I ask God to let me always be a light unto a dark place.
Yes.
And Lord, use me to be an instrument to be able to provide care for this family. And that I decrease, that He may increase.
Yes.
So in doing that as a caregiver, not only are you being helpful to the particular client or the patient, you have to be supporting for the whole whole family.
Right.
Because as you're taking care of the patient, you're taking care of the family as well. Because you may have family members that have emotional breakdowns or that are haven't been diagnosed yet, that have psychological problems, or they're feeling deprived in some way, or you're having people that are in the family, they feel guilty because they can't do it, or you're having a spouse where now, because when you're a caregiver, you become close to that individual.
Yes.
Remember, you are who they depend on. So
That's
now, here it is, a wife. She feels as though you've taken over her role. And where you have to make that person feel comfortable, that you have to include them, and you have to get those wisdoms from God. I've been in situations where, you could be in a situation where maybe the spouse may accuse you of certain things, is because they're feeling guilty and they're not able to even handle certain situations. You may have a child that may feel uncomfortable in attending to their body and seeing their body exposed. And in some situations, I've had clients where they didn't feel that it was appropriate for their son or their daughter to see them exposed. So, where the children got offended with me, and it wasn't me saying that, it was the client. And I have to respect the client's wishes, which overrides the children's wishes. So in going into each situation, you have to check out all the dynamics involved. Will it hinder me from doing a proper job in giving care to this individual, no matter what they may offer you? Because some situations I had to walk away from, and the money was extremely good, but the pressure was so overwhelming for me, I was taking those problems home. And I couldn't effectively do my job, what I needed to do regarding the patient.
Right.
So.
And, that's like she said, they have to be a match. The caregiver and the person you're going to care for, they have to like each other. Because if you don't like that person, if the client doesn't like the caregiver, things are not going to work out right. They're going to be kind of like a little shady, and she's not going to, whatever you do your best, she's not going to find that it's your best because, you don't click together. Mm-hmm. So we're going to take a quick break, intermission, and we'll be right back with you. Call someone and tell them to tune in. Welcome back to Conversation with Faye Lewis and Second Call. And if you want to call in, like I said, our number is 323-293-3375. And if you have something that you want to question, you want to ask, or you may want to share some information with us, feel welcome to do so. So Zola, what I wanted to ask you about the caregiving, what are some of the difficulties you run into when you're hired or you're taking care of someone and you go in there 5 days a week, 6, 7, 8 hours a day, and sometimes this person, different things happen. What are some of the difficulties you run into?
Well, one of the difficulties is if you have a patient who's in distress. And even though I've been doing it 35 years plus, there's still things that I'm still learning, and I still come across challenges. You have to have a point of contact, and there always has to be a line of protocol set in place if emergencies do happen. I have some clients when I go on an interview, and maybe after I'm there 2 or 3 days, and I want to have a line of contact set in place. Uh-huh. Oh, well, they're okay. I don't think we need that. If anything happens, just call 911. Uh-huh. But there has to be a line of contact to say, if something was to happen, someone may not want you to call the auntie, or to call the brother, or to call
family
niece,
members,
because maybe they can't handle certain things in certain situations. Mm-hmm. So I've had that to happen, and total disaster. Where I'm thinking, okay, I could call the sister, uh-huh, because I'm thinking she's strong. She can handle things. But come to find out, she's the one that breaks down. And the communication breaks down. She didn't call the brother. Then the brother's upset because he didn't get notified first. And then this one. So it sounds very simple, but if a situation arises, it blows up big. And then you have your patient who's distressed. Now, guess what? They're bringing all of that force, all of that energy back onto the patient.
Yeah.
So these are certain things that start off small, but they end up big.
And one thing I know about caregiving also, everybody's not called to do it. So everybody
Absolutely.
can't do it. You might have 5 or 6 sisters and one sister have to do it. And you're asking like, why do I have to do it? Why you chose me to do it? But that's who God has to do it. I know with my sister and my brothers, my mom, when she was ill, I had to take care of her. When I first started, I cried because I was like, I can't do this. I've taken care of kids, different things. But I was like, I cannot do this. This is just too much. But eventually I kept doing it. I had to do it. My sisters worked, my niece, everybody was busy. I was busy, but it was my calling. But my mom was my first client. And like I said, that's been some years ago. My mom was like 17. I think she passed in 2002. So, that's a long time ago to me. But in those years, I found out that this is my calling, and I love to do it, and I'm good at it. And I'm good. So they always said, you're going to get your money, whatever you do good, that you're good at, because you're going to put forth your best. So God says, a labor is worth his labor, so if you do your best. And like I say, caregiving is something that we, over the years, is really gotten to be a lot, and it's a big business, and it's a lot of work. But we know we want to make sure that everybody, next week I'm going to bring some support group names, and I have them. And I'm going to bring in some support group names and bring you other resources to get out. And we have to do the gym. We have to go do yoga, or we just have days off. Whatever works for you. Some people need to go get a massage after it. Whatever works for you, you have to do that. If you just go sit in the park, go walk in the mall, go sit somewhere and read a book away from, your job.
Absolutely.
And that's what I want.
Absolutely.
I want the Lord to bless Regina to be able to do. She really deserves a good vacation. I don't know if she's going to be able to take one without thinking about her parents, if they're going to be all right when she's gone. But I just ask God to give her strength and strengthen her and supply every need that she needs, and give her a peace and joy, and peace that surpasses understanding. No matter what's going on, that's a lot to have 2 parents go to the hospital in one day, And I remember a few months ago, her dad was in the hospital, her mom was out, so someone had to take care of her mom while she sit at the hospital with her dad, so that's a lot. Because nobody wants to leave their loved ones in the hospital, especially if the medicine is making them act, unbalanced. So you need someone to watch them, so that's a lot of work. So we have to know that caregiving is not an easy job, and they should up the pay for IHSS. Well, the government did say they were going to give $15 an hour, but he's giving them $1 a year.
Well, we know we can't wait on the government.
I'm not working for them no more.
But I wanted to add, when you said something and it sparked something in my spirit. When you are dealing with, when it's family members, you have to, you may have all this family around, and you say, why am I the only one that's doing it? And a lot of times parents could have 10 kids, but they know the ones who would be the ones that would be able to take care of them.
Yeah, true.
And if you are put in that position, you have to then become a delegator. You have to delegate your team. If you have your niece, Karen, once a week, she could come over and do the laundry. Johnny, once a week could come over and do a task as well.
Yeah.
Someone could come and relieve one individual for an hour.
Yeah.
Even if you go take a walk around the block, you have to step out of the equation, because if not, I guarantee you, and especially if it's a long-term situation, you will get burnt out.
My stepsister lives in Delaware, Wilmington, Delaware, and I went to see her last December. She had fluid on her brain, and they didn't think she was going to make it. So I flew back east to see her. And I was so blessed because she has 7, I think she has like 5 or 6 kids. This is my stepsister, which is, she's older than me, but she has like 5 or 6 kids, and she have a gang of grandkids and family. I promise you, this woman was never once left in the hospital without a family member being there. Not 20 minutes.
And they had a good support team.
They had a good support team.
And anyone can do it.
Yeah, well, not anyone could do it, because I know when my mom was sick, it was like I had to call certain people like, hello, are you coming to the hospital? Or she's back in the hospital. But I was saying about my stepsister, she was never there. And I said something to her daughter, and she was like, girl, I'm not leaving my mama in this hospital like that. And by them being there, being up on everything, the Lord blessed my stepsister. To date, the doctors don't know how the fluid drained off of her brain, and that woman is up live, and that's been 2 years ago. So that's a miracle right there in itself. But I was talking about the caregiving part, how her kids, and they come to see about her. And I just love them for that, because I admire them so much for that, because like you say, the whole family caring about, their mom. That's a blessed family,
When I, and let me reiterate on that, when I said anyone can do it, everyone has a role to play when you have a large extended family. And even if you don't, just like I mentioned, that someone could, even some family members can't tolerate to see their loved one sick or lying there, whatever condition they're in. Mm-hmm. So then they could take another task. They could run the vacuum. They could wash dishes. They could go pick up medication. They could be there with them on a particular day.
Babysitting.
Exactly.
Mm-hmm.
To go to the doctors. There's some type of task that they could do within the circle of the care plan for that individual.
Right.
Everyone has a role to play.
Yes, that's very important. And one thing I know they changed now, when you're a caregiver and you have to live in a home, or some elderly people are blessed to have 2 and 3 caregivers that go and come different shifts, and that's easy. And sometimes the children can't do it. The grown children, they can't do it. And they have to have people come into the home and do it, So it depends on the situation. But I highly suggest that if you are a caregiver and it's a 24-hour job, that you make it a point to find you an outlet, and we got to believe God that they're going to be all right while you go away for a day or 2, or all day or all night. Maybe sometimes you might just want to leave at night, whatever works best for you. But I highly recommend that you take a break, that you definitely get someone to help you, somebody, because like you say, it gets very overwhelming with one person.
Yeah. And you shouldn't feel guilty for doing that, because in essence, it will make you a better caregiver. When you step away from the equation and you come back, it's almost getting a recharge, and you're getting refreshed the same way if you were taking a vacation. If you're going to the Bahamas or going to Hawaii, and when you come back home, you're refreshed and you're renewed. Right. And you have to do that and to recharge yourself, mentally, spiritually, and physically, so you could provide better health care for that individual.
Right. And we definitely, like you say, you have to know your calling and know. And back to, again, I say that some family members, they don't like to do it. They can't, or they're too busy and they don't want to do it. So you're going to have to go outside of the family and get help. And the Lord, when you ask God to send somebody to help you, because God knows that that's a very overwhelming job,
Absolutely.
Very, very.
And you have to be, you really, through the years that I've worked and working in different arenas and situations and being around certain people, I could tell the ones who enjoy what they're doing and their passion, mm-hmm. and the ones that are in it for money. Mm-hmm. And I've seen some good things happen, and I've seen some horrible things happen. And you do have to be on top of it. You do have to be involved. You have to go behind individuals. You have to inspect. You have to be a good observant, and you have to educate.
And two, you know what I thought about? I was looking at some notes that I had taken down. I write down my thoughts. You know, a lot of times you find caregivers that has issues. And they're trying to take care of someone else. And I remember when we're laughing because I make jokes out of a lot of stuff, so don't take it personal. But I remember when my stepsister was in the mental hospital, when I would have to literally take a break from her, it would get so overwhelming, and she didn't want to take her psych meds, and she was bipolar schizophrenic. So I would get so overwhelmed, I would have to take what they call a respite, where you put them in, the home for a while, because she would fight and walk off. It was just very overwhelming. And I would put her in the, respite for a while. And I had to find out that some of the patients there, I would walk up to the floor she was on, and I didn't know the patients from the nurses, because then sometimes I be thinking the nurses taking the medication, because they've been dealt with it.
I know so well.
Like, is that the patient? No, that's a nurse. She's, you know what I mean?
Yes.
Oh, but yes, I've enjoyed today, and next week, hopefully, Skip and John and Marcy will be back. I really enjoyed you, Zola.
Thank you for the invite.
Yes. And anytime you're in the area, you stop by. So what are you doing now? Are you still working now?
Absolutely. This is what I love to do, and I've geared off. God has blessed me with so many different talents, but I always find myself coming back to this place. And right now, I'm embarking on because I've been doing it for so many years, and I'm so frustrated with the industry and all the politics involved. I've decided to open up my own business. And so right now I'm going for different licensing, and I have a wonderful husband that wants to back me.
Praise the Lord.
In that area.
Woo, for a good man.
To back me. And also I have clients. Clients said all you have to do is get the proper license and get everything started, and whatever you need to do, we'll back you all the way. So I thank God for that, and I give him all the glory.
I started my own business. Remember, Faye's assisted living?
Yes.
I wanted to do that and take care of the elderly in my home, or have a home where I could take care of them. And I want to be, and I still like doing it. I just don't want to do it every day or 7 days a week. But I'm dealing with family members, that have some health issues. But in saying that, I always wanted to be like, if there's an elderly person that can't live by themselves, then they don't want to be in the convalescent home. So I would be that middle person, and so that's similar to what you're going to be doing.
Well, no, I'm going to still have hands-on. I'm going to have hands-on.
I mean, how skilled are they just going to be, like I said?
Well, I eventually I want to take up to the level. They have different levels of care.
Right.
But right now I will be doing assistant living. And then after I get certain license in place, I will be doing all the way up to total care.
Okay, well then,
total care.
Yeah, so you'll end up going all the way into hospice care and all.
Absolutely.
Okay, well I'm gonna be keeping you up in prayer. And if I ever decide I want a job, my sister can have her own business to get. One more quick thing before I leave also is that sometimes I've seen caregivers get so distraught in the job and so overwhelming till they just about almost have a nervous breakdown.
Oh, I've seen it. I've been there.
Yeah.
I've been there when I believe, and I had to research myself. When we step out of the arena, when we depend totally on us, and we think that our strength comes from us, yes, we have breakdowns because we have to deal with so many dynamics in dealing, because it's different when you have the dynamics in dealing at the hospital, because at the hospital everything is such a fast pace, and you're not dealing with a patient or a client inside the hospital. You're dealing with this patient inside their home. So it changes all the dynamics. Not only are you dealing with the patient, you're dealing with the children, you're dealing with things that go on within the family, within the home.
When you go into the home.
Absolutely. Because they may not look at it that way, but you are becoming a part of the family, especially if it's for a long term. You may hear things and different arguments, different things that are said. You actually become a part of the family. You hear things, there may be secrets that have not been disclosed.
Right.
Or
right,
you have
yeah.
patients. Patients have shared things with me that they
Right.
have not
Yes.
shared with their family.
Yes.
And I've had to promise them on certain things
Yes.
that I would not disclose it. And how do you still deal with that? And then you have to go back and deal with this with the family members after certain things have been said.
Well, I know that God has a plan for each and every one of us, and what they say, stay in your lane. And I know that caregiving, that God has called me to do that. And like I say, I love to do it. And in doing that, when you're going to the hospital, making doctor appointments, administering medications, make sure you're giving the right medication. And I took classes. I ended up taking a class where we learned about dementia, Alzheimer's, different illness, Crohn's disease, how to do CPR, all of these things you have to know when you're really going to be, in the caregiving business, because you never know what given day, what may happen, And like you say, I've been so overwhelming till I had to be like, oh my God, please let me have some relief, And then if you're the main caregiver, no matter what that person is going through, you got to be there.
Absolutely.
And like I say, that's the plan, I believe, for each majority of each patient I've had. I had a couple of them I know God didn't send my way afterward. But I've had a lot of patients that I know that God sent me there for a time and a season.
Yeah, and education is the key. Even if you don't plan on making this a career or a long term, even if something that was pushed on you and you didn't ask to be in that situation, education is the key, because once you have education and the psychological, if you're dealing with a patient and they start acting out a certain way, it's very important that you know the psychological aspect of why they're acting that way. So education is the key. And some people may say, I've heard people, family members say, oh, there's nothing wrong with them. They just acting out. They wanted attention. They always have been like that. They wanted attention seeker when they were young, or she's just a drama queen. No, it's part of their illness. You need to be educated on it. They're not just acting out. She's not just being a drama queen. So these are the things that are very important. And when you know what you're dealing with, you could better handle the situation.
Yes. And you always got to just stand back and look, And like I say, when I take care of a lady or a man, elderly, young, middle age, I want to always be in a place where when I go to work, that I'm happy when I go there. I don't want to have patients that you're dreading to walk through that door. Oh my God, I don't feel like going today. I don't feel like being bothered with them. Well, this is your job and this is something you have to do. So you want to go in there with a smiling face. Good morning. How you doing? It's a blessed day. We woke up, bring joy and peace in the home. And that's a good way to come in and forget about you, how you feel, and take care of that person today, brighten their day, because the Lord always said, if you take care of mine, I'll take care of yours.
Amen.
Amen. So I know that caregiving, like I say, and then when you do the assisted living, you're just assisting them. So you have a person that maybe they can still walk, but they need to walk alongside someone, go to the store. Those are light duties. And that person is a pleasant person. They always want to leave the house, and go places, and you assisting them wherever they go. That seems like a little easy job, but you have to be careful, like you say, taking this person in and out. You still have to watch them, make sure they don't get too hot in the summertime. Remember 2 months ago, it was like 110 degrees, and I was with a senior citizen, and she fainted in the store. I think I was actually, I told you about that, and she fainted in the store, and that really bothered me, and it scared me, but I had to be calm about it, because like I said, I've been doing this, and just make sure I didn't see no signs of nothing else going on. So, you you have to be very careful, especially when you're dealing with other people, parents, or just other people. Like you said, all lives matter.
And when I can remember that distinctly when you called me, and the thing was that you were questioning about the patient didn't want to go to the hospital. And I kept reiterating with you to put protection on yourself and to put protection on the patient. It was no question. She needed to go because things could have been going on that only that
a doctor could
that
tell.
could be tested.
Right.
That would be exposed. If she was having a stroke, a mild stroke, she could have recovered and said, I'm fine, I'm okay. And you take her home and she has a massive stroke.
Okay,
then you would be held responsible.
Yes.
You'd be held liable.
Yeah.
And those are the things that, when I mentioned earlier, the protocol, what things need to be in place. If a case like that happens, it's no question that whether I take her to emergency, whether I don't take her, you need to have that person of contact who I would call.
Right.
And I'm taking your mom, your loved one, onto the hospital. You need to meet us there, or you need to find the next plan.
Right.
Things need to be in place when emergencies happen, because you didn't know that was going to happen, and it just happened in an instant. Things do happen.
Yes.
So things need to be in place. And another thing that was very important, I noticed that when I've trained other caregivers, or I've trained my coworkers, and in working in the field, people are quick to get offended and jump to defense. You're dealing with an ill person, and in dealing with an ill person, when you're in pain, they may cuss you out, they may kick you, spit on you, hit you,
And you be thinking,
put
there
you
ain't
out.
nothing wrong with them.
You can't get offended and take that in offense, because when people are in pain, they're in pain, and their pain trumps out any other thing. And so in being a good caregiver, you have to know that when you're doing this, a lot of times, I've worked for people that hated my guts. That I worked for one lady, the only time that she came in contact with blacks they were servants. And she never dealt with blacks outside of that realm. So in dealing and working with her, I knew she was prejudiced. I knew she didn't like me. But guess what? Nobody else was going to deal with her. And I knew that I was assigned to her by God. So these were the things that I had to work through. And I had to step away, because back then I wasn't all that delivered. And I knew that I was sent there. But I wasn't at the place where I'm at now, but a lot of times I had to step away to be able to handle the situation effectively, because no one likes to admit that my total dependence is all on you. In order for me to get up out of this bed, in order for me to go to the bathroom, I need you.
And another thing too is that a lot of people, even young people, me, I believe if I got sick and someone came in to take care of me, let me do this by myself. Still trying to be independent. And so you deal with that too, where they still want to be independent,
or think they could do it,
and that's a good thing, because they say when you lay down and it's over, you're not gonna be able to do nothing. So some people think I got to keep busy, I got to keep moving. But we enjoyed you today, Zola, and we're going to be cutting down and cutting out and tuning out, getting ready for next week. But next week, we're going to talk about real estate. I have a couple of people that's going to be here that's going to give us very good information and talk about homeowners in our African-American neighborhoods, homeowners. And so she has a lot of information to bring to us. So we're going to be back next week. Tell somebody about Conversation with Faye Lewis. And if you ever decide you want to call in and talk about something, it may not even be the subject. You may just want to vent. We're here for that. We're here for you. So we ask you, God bless you, and you have a blessed week. And always remember, stay in your lane.
The Consortium of Health and Military Performance, also known as CHAMP, of the Uniformed Services University of Health and Science, known as USUHS, is conducting a study to understand a possible genetic link between sickle cell trait, known as SCT, and exercise-related events, known as EREs, such as exertional rhabdomyolysis, muscle damage, heat stroke, and or collapse. We are inviting African American men and women with sickle cell trait and their family members to participate. Participating in the study will require you to complete a health history questionnaire, a form authorizing our study physician to gather health information from you and your healthcare provider, as well as a one-time blood donation. In order to qualify for the study, you must meet the following criteria: be African American, be sickle cell trait positive, be able to read, speak, and understand English, be between the ages of 18 and 80, and currently not being treated for any mental or psychological disorders. Participation is completely voluntary, and your decision will not impact your healthcare. The results for this study are for research purposes only and are not intended to directly benefit any individual for confidentiality reasons. However, the results of this study are intended to help better shape policies and associated health risks affecting the SCT community. Participants may be compensated for their time. To join the study, or if you would like additional information regarding the study, please contact the study team by phone, area code 240-479-9514, or email sctstudy-ggg@usuhs.edu.